Hello, everyone. Hello, everyone, and welcome. My name is Steph Vivier. I'll be hosting this evening, and I want to welcome you all to tonight's live and interactive telephone town hall. Tonight, we will be discussing the homelessness, addiction, and the mental health crisis in our community with Mat Siscoe, Mayor of the City of St. Catharines. Tonight, we are calling thousands of residents from across St. Catharines. It will take a few minutes to connect with everyone. So as we are dialing out, let me just take a moment to explain how a telephone town hall works. If you'd like to ask a question about the homelessness, addiction, and the mental health crisis in our community, just press *3 on your phone. Currently, people from across the city are answering their phones and connecting to this discussion. Once someone answers their phone, they stay on the line to join the discussion. For those who miss a call, a voicemail message will be left with directions on how to provide your feedback. This telephone town hall technology enables us to reach out and talk with thousands of people from the comfort of their homes. It is a great way for the mayor to stay connected and ensure residents have the opportunity to ask questions live and listen to the answers. So for those of you just joining the call, welcome. This is a telephone town hall where we will be discussing the homelessness, addiction, and mental health crisis in our community with Mayor of St. Catharines, Mat Siscoe, Chief Administrative Officer, David Oakes, and representatives from NRPS, Niagara Region Community Services, Public Health, and Niagara Assertive Street Outreach, NASO. For those of you who would like to ask a question, please press *3 on your phone. As we wait for everyone to join the call, I would like to give our panel members the opportunity to introduce themselves by saying who they are, what organization they are from, and a brief description on what their role is. We'll start with Dave Oakes.
Thanks, Steph. David Oakes. I am the Chief Administrative Officer for the city. I'm responsible for all of the staffing and direction that we do in our parks, in our community, and trying to do everything we can to make St. Catharines a great place to live, work, and play.
Thank you, Dave. Let's go now to Inspector Rob LaPlante.
Good evening, everyone. My name is Rob LaPlante. I'm District Commander of one district here in St. Catharines, which covers St. Catharines and the City of Thorold. I manage the personnel in the building, as well as provide a conduit to listen to citizens' complaints and apply a frontline response to through the police service.
Thank you, Inspector LaPlante. Cathy Cousins, let's go to you.
Thank you. Good evening. I'm Cathy Cousins. I'm the Director of Homeless Services at Niagara Region, and my responsibilities include administering the homeless system, including prevention services, outreach services, shelter services, and supportive housing. Thank you.
Thank you, Cathy. We move now to Dr. Azim Kasmani.
Hi, everybody. My name is Azim Kasmani. I'm the Medical Officer of Health as well as the Commissioner of Public Health and Emergency Services at Niagara Region Public Health. And what we really do is work on prevention and looking upstream and preventing things before bad health outcomes.
Thank you, Dr. Kasmani. And now, Matt Derricks on behalf of Shelly Mousseau.
Hi, everyone. My name is, she already said, I'm Matt, and I am the supervisor of the NASO, or Niagara Assertive Street Outreach Program. And my role is to supervise the program as our team meets everyone where they are at on the street, and provide support the best we can.
Thank you, Matt. And over to Mayor Mat Siscoe.
Thanks, Steph. And hello, St. Catharines. Mayor Mat Siscoe here. I am thankful for you for taking the time to join us on the telephone town hall tonight. Your input is important to all of us, and that's why I'm here. That's why our partners from the Niagara Regional Police Service are here, Niagara Region Community Services, Niagara Public Health, and NASO. That's why they're all here tonight, is to bring information to you, to hear your questions and try and answer them as best we can, because we know how important this topic is. Since I became mayor, the homelessness, the addiction, and the mental health crisis has been probably my number one priority. And when I say probably, that's not correct. It definitely has been my number one priority. It's the thing that my office deals with every single day, and it occupies a large portion of my time. Every day we get calls, we get emails from residents concerned about what they're seeing on their streets, concerned about the welfare of the people they're seeing that are forced into situations living unhoused in our parks and in the creek system. And so from my perspective, this is our opportunity to clear up some of the misinformation that's out in the community and also answer the questions that I know people have because they come through our office regularly. As many people know, my career before this was a physics teacher. I tend to be a very logical thinker, but more than anything, I try to solve problems. And this is a problem that plagues not just us here in St. Catharines and Niagara. This is a North America-wide issue. And on a daily basis, I try to make sure people understand that. When I talk to my colleagues in London or in Guelph or in Toronto or in Ottawa or in Kingston or in Cambridge, we're all dealing with this issue here in Ontario, and it's no different from our friends on the other side of the river in New York State. It is truly continent-wide. And I think I speak for most of us when I say there's been a lot of difficulty in navigating the situation. There are a lot of limitations that exist. Based on the calls and the emails I get, I can tell there's a lot of misinformation out there. And what the various agencies, like the city or the Niagara Region, or Niagara Public Health, or the NRP or NASO, there's misinformation about what they can do and what they can't do. So one of the things we're going to do tonight, the reason why we have these speakers here, is to speak to those topics. Telephone town hall has been used in the city for a number of years with the budget, and we felt this was a good situation to use it as well. I really appreciate everybody who's listening in tonight. I appreciate everybody who's in line to ask questions. If you do have questions, please press *3 on your phone. That'll put you in queue to be able to hand off to somebody. You can get your information to them, and then hopefully we can get to your questions tonight. And Steph, I'll throw it back to you.
Thanks for that information, Mayor. And for those of you who are just joining us on the call, we are here tonight for a special telephone town hall discussion with Mayor Mat Siscoe, NRPS, Niagara Region Public Health, and NASO to talk about the homelessness, addiction, and mental health crisis. If you have a question, press *3 on your phone at any time. And looking at our systems, I can see there's thousands of people already on the line and still more to join onto the call. But before we officially begin, I want to take a moment and ask a couple of questions of my own. And the first question I have is, what are the budgetary impacts of the homelessness, addiction, and mental health crises for the City of St. Catharines?
All right, well, Steph, I think that one goes to me. The city is committed to trying to ensure individuals that are experiencing homelessness receive the support they need. And we're doing what we can, but our scope is very limited, right? Supporting the homelessness, the addiction, and the mental health crisis comes with a price tag. Even though the City of St. Catharines is not directly responsible, we know in 2023 the cost will be upwards of $1.76 million. Those costs don't include the vandalism and the repairs and the thefts that we do experience, the day-to-day needle and waste pickup. That number really only accounts for the full-time community outreach coordinator that the city had to hire. There's a partnership with NASO, which is part of the reason why NASO is here today, because we've engaged with the region in partnership with them and with NASO to work on community outreach. That deals with encampment cleanup costs, because when those encampments are taken apart, there's a cleanup that has to come along with it. There's increased staffing that we have had to do with the city because of the health and the safety concerns. Many of our staff in parks specifically aren't able to work alone anymore, and that wasn't the case before things started to get bad. That number also this year accounts for a portion of the costs over at 320 Geneva Street, and there's a very good news story about 320 Geneva Street that I hope everybody has heard about in the last 24 hours that myself and Cathy Cousins from the region will be happy to expand upon tonight. And then costs associated to the self-cleaning washroom and other areas like that. So the budget impact is significant in St. Catharines, but it's something that we know we need to spend the dollars on to try and deal with the downstream effects of these crises.
Well, that's great information, Mayor Mat Siscoe. I do have another question before we dig into all the questions coming in. Again, if you do have a question and you're on the line, please press *3. Over and above the budget, what is the City of St. Catharines doing to address homelessness? So
this is a lot of a conversation that I have on a regular basis. It should be recognized. So St. Catharines is what we call a lower tier municipality. We're a part of the region. And so we're not directly involved in housing. We're not directly involved in the homelessness services like a lot of single-tier municipalities are in the province. The city works closely with our community partners, many of whom you see on the panel today, to help individuals experiencing homelessness transition to more appropriate accommodations. And because city staff are on the front lines, city staff oftentimes are faced with the issues first, and they're able to figure out what path we need to take to deal with the situations. We're regularly considering the needs of individuals that live in encampments. and in the community at large. We dedicated funds to outreach back in 2020 as a pilot, and in 2023, our current council approved funding the outreach for the full year out of our operating budget. And we see that as an ongoing cost because we recognize the value of the partnership with the region and with NASO. Since implementing that outreach strategy, though, we've had 400 housing placements. So people that have been placed into housing through NASO. Additionally, and this is the good news part, I guess, thanks to our partners at the Niagara Region, yesterday we were able to announce the good news about the city and the city's vacant property that was 320 Geneva Street that's going to be developed into supportive and affordable housing. The city and the region work together to make this happen. We're excited and proud because our community desperately needs it. But as I said at our Public Health and Social Services meeting yesterday, this is the first step, but it's the first step of many. And we're going to continue to strengthen that partnership with the region and with the Niagara Regional Housing and our community partners to see that we get more of those built in the future.
Thank you so much, Mayor Siscoe. That's a lot of great information and some answers to my questions. And for those of you who are just joining on the call, we are here tonight for a special telephone town hall discussion with Mayor Mat Siscoe, NRPS, Niagara Region Public Health, and NASO to talk about the homelessness, addiction, and mental health crisis. If you have a question, press *3 on your phone at any time. And I think we are getting ready to answer some of the questions that are coming in. We did have an opportunity to have some online questions that were submitted to start. So we're going to start with one of those questions. I'll read that out now. And the question is, why aren't encampments being cleaned up and bylaw breakers fined and or supported to find shelter in appropriate places? What steps will the city take to promptly remove the encampments along 12 Mile Creek, considering the dangerous current unsightly conditions, of public health risks, and compromised pedestrian safety they present? Furthermore, what measures will be put in place to prevent their reestablishment in the future? What are some specific initiatives being done to keep the trails throughout the city safer for residents to use?
All right, so I'm gonna look over to Dave Oakes for that one. I think Dave can start that question off.
Thanks, Mayor. Thanks, Steph. Yeah, I'll start and maybe I'll pass it over to some of our partners because it is a very complex question that you presented to us. First and foremost, camping in our public spaces is against the municipal bylaw. However, there was a recent court ruling in Waterloo which prohibits the dismantling of encampments if there are not accessible shelter spaces available. So that limits what we can do as city staff in terms of being able to manage the encampments along 12 Mile Creek. What I can say, though, is this past year we entered into a license agreement with OPG, Ontario Power Generation, on a license agreement where we have added some additional park staff in the 12 Mile Creek area to help maintain the trail system. In partnership with our NASO and Niagara Region network, our staff are in constant communication with the NASO staff as well as NRPS and the region when they come across various encampment sites, so we can then have the outreach workers go and approach the encampment individuals who are there. And maybe Matt, if you want to build off of that, thanks.
Sure, thanks. I can talk a little bit about that. So our team is there essentially daily, sometimes every other day, but we're there every day to offer services to the people that are there. We continue to work with them to try to get them into shelter if that's what they're going for, or other kind of work that needs to be done for them to be able to access housing or housing programs. So we work daily with them to get those kind of things set up and get them into support. And then while we're there, we're also checking things out to make sure that it is safe as possible. So we partner with Positive Living Streetworks. We're on the phone daily with them. We get them to come down and take care of any biohazards that we see to ensure that we can keep the area as safe as possible.
Hello, everyone. Rob LaPlante here from NRP. Just to let you know, our frontline officers offer some proactive foot patrols as well as crime patrol initiatives throughout the year, specifically with parks in other areas of the city, as well as in April of 2022, the service created the CORE unit, which is the Community-Oriented Response and Engagement Unit. This unit provides enhanced youth engagement, community outreach, as well as problem-oriented policing initiatives. This also includes downtown foot patrols, bike patrols in parks. So I know quite often you'll see our officers out patrolling parks at various locations throughout the city on bicycles, and engaging with those who are at encampments as well as to offer services and to provide them with the resources that they need.
Thank you, Inspector LaPlante, for that question. We're going to start now with the phone calls. And a reminder, if you do have a question and you're on the line, please press *3 on your phone at any time to get into the queue. We're going to go now to Bryce, and we were just talking about encampments. Bryce has a question about encampments. Thank you so much, Bryce. Let's hear your question.
Hi there. Can you hear me okay?
We can. Go ahead, Bryce.
Yeah. Okay. Thank you for taking my call. The call was, basically answered there, but what you're saying is there's really nothing that can be done. Where we live in Glen Ridge, and I'm an empathetic, sympathetic person, I know it's a very complicated problem. I also live here, have a family in the Glen Ridge area, and there are encampments all around. There's an encampment across the street from the golf course where the city is now cutting the grass around the encampment. It was 1 tent, then it's 2, then it's 3. It's all down 12 Mile Creek. I have young kids. There are needles. There are people shooting up in the street in front of the encampments. There are people shooting up in that washroom, outside that washroom. Like, you're telling me because one judge in Waterloo, we're more or less paralyzed here and there's nothing that can be done. Like at Glen Ridge School, in the area where we live, it's townhouse condos, someone could just set up a camp at that park and there's nothing that can be done. That's correct? That's my understanding?
So, Bryce, I will say, first of all, I have spent a lot of time in the Glen Ridge neighborhood. I've heard all of these concerns, and you are 100% correct to be frustrated with the situation. I will say it's not so much that nothing can be done, but the idea that we can go in and simply break up encampments, that is what the Waterloo ruling has said. You can't just go into a park, break up the encampment if you don't have suitable shelter for people to be able to go into. And the reality is, until this year, we were in a situation where, by and large, we had enough shelter spaces to be able to deal with the encampments. But we have seen an increase over the last couple of years. The numbers continue to rise, and we now have such a large population of homeless individuals that we don't have the places. And that's where the Waterloo decision comes in. But I will say it's not a matter of not being able to do anything. It's that we need to change some of the things we're doing. And so right now at the region, I'm going to turn it over to Cathy Cousins in a second because I know she can speak to this, but we are looking at additional shelter options and different types of shelter options. The announcement from yesterday with respect to the bridge housing will help, but we also know we need temporary solutions that are going to get us to the point when those bridge housing spaces are available. And I'll throw things over to Cathy at this point.
Thank you very much, Mayor. Maybe the only good news I can provide for you in this moment is we have, and thanks to the provincial government for our new influx of funding, the opportunity to open a large full-day shelter in St. Catharines, and we are looking for a site as we speak. I'm hoping to have that open before the end of the year. That will create capacity within the system to enable us to continue to move forward the way we have in the past and support community with encampments. I think the one other piece I'll mention, and I may even turn it over to Rob LaPlante after this, the judge in Waterloo left one loophole in the conversation around when a cleanup needs to happen for health and safety reasons. The particular ruling was very associated with a specific piece of property, so there is some room to maneuver that we're working around in order to support you better with those encampments. But there is a health and safety element, and I don't know, Rob, if you want to add to that.
I'll just add that I know we all work feverishly on trying to address these encampments. There's not one approach, unfortunately, that the silver bullet, as you would say, that is going to solve the problem right away. Certainly, from a policing perspective, we can't arrest our way or out of this situation. It's going to take a collaborative effort with everybody here at the table, as well as federal and provincial government to get on board to have a reasonable solution that can be applied not only in St. Catharines but across the province.
Thank you so much, Bryce, for the question, and thank you to the Mayor, Cathy, and Inspector LaPlante for answering that. We now are going to head back to the phones, and Doug has a question about an arena that's being torn down. He has a unique idea and a question about that. Doug, you're on the line. Go ahead with your question.
Hi there. How are you?
Go ahead, Doug.
Yes, I just don't understand how we had this big arena there that could have been a massive shelter right now that could have been solving the problem. And not only that, I see all these immigrants coming from Ukraine and people being put to the bottom of the list by the Niagara Regional Housing, and it's not right. Us Canadian citizens should be coming first, and this problem.
All right, thanks, Doug. I will start with the first one. The arena actually would not have been a good shelter use. There's a belief sometimes that we need large shelters, but that tends to concentrate a lot of issues all in one place and is not the best case scenario. The arena, if you look at the best practices for sheltering people, that's not how we do it. I will say, as the Vice Chair of the Niagara Regional Housing Board, what you just described is actually not true, and I'm glad this question came through the way it did, so I can clear this up, because the immigrants to Canada, refugees to Canada, are not being prioritized ahead of everybody that's on the list. That simply doesn't happen. That's not how Niagara Regional Housing operates its list. There are federal government programs with respect to immigration and refugee services that will help immigrants and refugees when they come to Canada for whatever reason they do. But in terms of the public housing that exists in the Niagara region, the housing that is dealt with through Niagara Region and through Niagara Regional Housing, that's just simply not what's happening. And that's one of those rumors that gets out into the community and creates a lot of really negative ill will against newcomers to Canada, people that are struggling to just get on with daily life. And I hope to the folks that are listening in on this call that you understand that that's just simply not the case. And it's things that people say to try and generate negativity towards newcomers to Canada that they don't deserve. In a lot of cases, especially with the refugees that have come to Canada and have been brought to Niagara in the last couple of months, these folks are fleeing from very horrible places, very dangerous situations. And to add that level of negativity to them, that's not fair. Niagara Regional Housing has very clear policies. Those policies are spelled out in a number of different places. And if people are interested, I encourage them, reach out to Niagara Regional Housing to understand how we prioritize people. There's very clear requirements for people to get on the waiting list. It's frustrating to me, as well as to everybody at Regional Housing, how long the list is, but we're going to continue to work at getting through that list.
Thank you, Mayor, and thank you, Doug, for that question. A reminder, if you're on the line and you do have a question, press *3. We're going to go now to Jeanette. Jeanette has a question about vacant housing. Go ahead, Jeanette.
Yes, there's a place called Women for Women on Queenston and Tasker, and I'm not sure the name of the street, but going down towards Cross Street, there's a house that's been vacant at least 5 years, maybe 10. And the mayor said when he came to visit us at Women for Women last year, he was going to do something about it. And I swear, more than 5 years, no one's been in that house. There's nobody living there at all. It's quite a big house. So that's part of the problem for people on the street. And the other problem is I've been sober 29 years. I can't imagine someone handing me a little drink every day. Needles should not be provided. That is such a dumb solution. They need to provide help to stay off the needles, not give them needles. So that's my comment.
All right. So maybe I'll look over to David Oakes to talk about the private properties, and then Dr. Kasmani might be able to speak to the needle programs.
Sure, I can speak specifically to the vacant house issue. We agree with you. You know, vacant houses are unsightly, but they're also higher risk for fires, break-and-enters, and a whole variety of other safety issues. In 2022, Council approved a vacant property bylaw that encourages the property owners to essentially tighten up their building, maintain it, and if they are unable to, we actually have the ability to fine the owners for not maintaining the property in certain standards. The challenge we run into beyond that is if the property taxes are being paid and they continue to be paid, there's not any other mechanism other than the vacant property bylaw for us to go in and do anything with that specific issue. But the bylaw itself is something that we're working through as we speak.
Thank you, Dave. Dr. Kasmani?
Yeah, so thanks for the question, and it's a good opportunity to talk about the different ways and the different services that are available to help people who do suffer from addiction. And I think that's the key here, is that an addiction is a very powerful thing, and there is a physiological response, or a response our body has to that. There's different ways, though, and different people need different things. So treatment is one way, and we are seeing an increase in the number of providers of safer supply options. And that is giving people substances, but safe substances. And over time, what we see is very often people tend to use less, and they are able to get back to the way they want to be, as well as harm reduction services. So, oftentimes people are going to use substances. We see this in our community all the time. Prohibition didn't work, and we see that way back when. And so there's safer ways to provide substance to people, and so we don't see all the negative health outcomes associated with that. But the evidence does show that these different programs do actually work.
Thank you, Dr. Kasmani. Thank you, Jeanette, for the question. And we're going to go now to Diana. Diana has a question about contractors building luxury housing. Go ahead, Diana.
I just wonder why the city is allowing all these contractors to build these extremely expensive condos and housing, and there's no housing for the homeless. There's no affordable housing for the people. We have to have at least 20,000 people that can't afford apartments. And the apartment prices are so extreme, nobody can afford them. The whole family has to move in. You have to live with your kids, even though they're older, because you just can't afford it. I want to know when you're going to do something about it.
Diana, I appreciate that. And this is something actually that comes up a lot whenever we have a new development come forward to council, and people get very frustrated, and I appreciate the frustration. The situation that the city's in, though, is we can't actually dictate beyond our zoning policies and our official plan. We can't dictate what somebody builds on the property. So if a developer comes, and I'll use an example in the downtown, if a developer comes to the city with a development plan in the downtown for a piece of land and they want to put 20 stories of luxury condominium, let's say, unless they're violating our zoning bylaw, we can't tell them, oh, you have to have this type of housing in this proportion. That's not something we're really able to do. And one of the things, and this is another piece of misinformation I really want to get out to the community today, there's a belief that private developers are going to build affordable housing, that they're going to build rent geared to income, but that's really not the case. It's not been the reality anywhere in North America. There's no real way to force them to do that. And then the reality is those buildings are very expensive to build, and they don't return on the investment. And private for-profit corporations are trying to make a profit. So when it comes to building those affordable housing units, that's something that has to fall to government. In previous decades, we would see sort of an all hands on deck. You would have cooperative housing built by multiple levels of government. The federal government was involved with it, the provincial level of government was involved with it, and the regional level was involved with it. But it's really all fallen to the regional level of government over the last 2 decades. And that's a problem, because the truth is the region, like the city, doesn't have the capacity or the money that the provincial and the federal level of government have. So Niagara Regional Housing is working very diligently to try and find new ways to get units up. And I know there's a number of builds going on. Like I said, we announced the build tomorrow, but there are new builds that are coming on stream. But it's going to be really difficult without injections from other levels of government. And so, when we get to the end of the evening, we're going to talk about take-home messages. One of the take-home messages has to be talk to your provincial and your federal members. A lot of them understand this. And I will say we've had really good feedback and conversations with local members, provincial and federal, here in Niagara, but it's getting the parties to understand that they have to put dollars behind it at the provincial and the federal level as well. Because we know on the ground, at the city and the region, we know on the ground what the issues are. We know what needs to be built. But we can't just keep going back to the property tax base. Like, that's difficult enough to do all of the other things we have to do. And as things get more difficult, we're going to need more help.
Thank you for the question, Diana, and thank you for the answer, Mayor. We're going to go on to our next question. Tiffany has a question about multi-unit housing. Tiffany, what's your question?
Hi, thank you very much. I'm going to kind of add to Diane's question, and if the mayor could kind of help me with this one. First, I'll say I understand that the solution to these issues is going to take many different initiatives to help relieve the pressures of the housing and the crisis affordability, but that's where I'm going to ask my question towards. Can you expand a little bit on what the city is doing either through the bylaws, tax incentives, encouraging multiple generational housing, maybe adding in-law suites, encouraging developments in like basement apartments to help relieve some of that top pressure of the need for that housing, that affordable housing, basically taking these spots that we can expand on and open up some housing.
Definitely, and I appreciate that question because it's a really good point. So the City of St. Catharines passed a housing strategy a couple of years ago. We created a new housing strategy this year to meet with the provincial requirement for housing units. As a part of that, what we call accessory dwelling units was a part of that, and creating a grant program to help people build out accessory dwelling units. Along with that, the provincial government made a change that mandated that you had to be able to have more accessory dwelling units. As of right, you could build more accessory dwelling units on your property. So the city is involved with incentives to help people who want to build those accessory dwelling units, who want to create, an in-law suite or, what used to be considered a granny flat. Like, those can happen now, and the city is there and has a program in place to be able to help with funding that. It's a part of our community improvement plan, our community improvement program. And the CIP, you'll hear about it in the media, and a lot of people try and make it sound like a terrible program, but this is exactly the kind of case where the CIP is so important. And so when you read about it, understand this is a program that can help us build those smaller units that might be appropriate for a senior on a fixed income who wants to rent, or, a young student in the community that needs a place to live, kids that are moving out but are not wanting to go and buy a house right away. Like, all of those opportunities, accessory dwelling units are really a large part of the answer, and the city does have incentives for that. So you can create those multi-generational houses if you want, or you can use it to supplement your income, to help pay the mortgage, whatever the case may be. I think that's an important piece of the puzzle. I appreciate the question.
Thank you, Tiffany. Thank you, Mary. You got to watch the media. Appreciate that. We'll go now to Dave. Dave has a question.
Hello.
Go ahead, Dave. What's your question?
My question is in regards to what NRP can do in regard to people who are issued formal trespass notices from properties beyond taking them 2 blocks away and dropping them off so they return.
Thank you for the question.
Like I said, it's usually, unfortunately, people who are experiencing homelessness. So, issuing them fines would not be a solution.
Thanks for the question, Dave. Yes, unfortunately, the Trespass to Property Act it does provide us with arrest authorities to arrest somebody and issue a provincial offense notice. However, there's no jail term that's associated with that. So realistically, we do caution individuals from returning to property, but unfortunately, it's not something that is enforceable through the court process, just because it's a provincial legislation in that regard, and it's usually dealt with through the provincial offenses notices.
Thank you for that question, Dave. Thank you, Inspector LaPlante, for answering. And we're going to go now to Damari. And Damari, you have a question has to do with your son. You can go ahead, please.
Yes. My son is a drug addict and has mental problems, and I have no way of helping besides giving him where to stay, but he left again. The thing is, I've tried to get help to see if I can put him in a shelter or make any information about him. I can't give any answers to anybody because he's an adult and I can't speak for him. I can't sign for him or help him out to get into shelter. Is there any paperwork that I would need to do to help him out to do that?
Thank you for your question, Damari. We'll turn it over to Dr. Kasmani.
Damari, thank you for raising your question to everybody. And I think it really highlights that even if people suffer from addictions, they're still someone's loved one. They're still someone's child or parent, or they're a human being. And it's really important that we all remember that as we think about these issues. There is a website that is called SaveMyLife.ca where you can go online. You can enter in some of the situational information, and it gives resources that you can follow or you can call or follow up with that may be able to help you. Now, again, I think you highlighted that he's an adult and you can't make decisions for him. You can't force him to do anything, but that may be a starting point. So again, that website is SaveMyLife.ca where you can hopefully access some information that will be able to help you and help him.
Thank you, Dr. Kasmani, and Matt wanted to jump in.
Yeah, just to also to help provide some additional resources. If you know where your son's staying, you can always call 211 and ask for NASO or Niagara Assertive Street Outreach, and one of my staff can reach out wherever your son is and see if we can kind of offer services from a different angle. Sometimes talking to somebody else can help. So 211 is the ticket there, and that will go to all of my staff, and the closest one will be able to meet your son and maybe provide some help.
Thank you for the question, Damari. I hope that provides some relief and hope for you tonight. And we go now to Chris. Chris is on the line. Chris, what's your question?
Oh, and good evening. So I overheard our Premier, Doug Ford, speaking at a press conference, and the question was about the encampments in Hamilton, and did he have a solution? And his comment was, and I appreciate it's Doug Ford, was that these people need to go back to wherever they are in the winter because we don't have encampment problems in the winter. And then that was the end of what he had to say. My thought here is he offering a solution of maybe more monies for some of our out of the cold programs to expand to be available 365 days of the year? I don't know if any of you also heard that press conference last week. It was in Hamilton. So
thank you for the question, Chris. Cathy Cousins will take your question.
Good evening, Chris. I did not hear the press conference, but what I think I can offer is Hamilton, like Niagara, also did receive some new provincial funding in the recent announcements. And while I can't speak specifically to how they're using their new money, Niagara did take the opportunity to take a good look at seasonal shelters. And with the advent of new money, it gave us the opportunity to do better. And unfortunately with seasonal shelters, first of all, they're seasonal. And then during the day, unfortunately, it means we don't have staff working with clients to support them in reaching their housing goals. So we are converting all of our 95 beds in Niagara Region of seasonal shelter into full-day, 24/7 staffed shelters, effective this fall. I'm hoping to have one of the two open by October and then the other one not long thereafter. But no, I'm afraid I did not hear Mr. Ford's statement.
Thank you, Cathy, and thank you for your question, Chris. We're going to go now to Matthew. Matthew, you have a question about laws surrounding drug use. Go ahead.
Yes. Like when I was younger, when I was 19, I got arrested walking down the sidewalk for public intoxication, being drunk. So what are the police doing about people basically shooting up in the middle of the street? Like from what I can tell, I've called the police a couple times. all they do is tell them to move along. There's no programs in place. Nobody gets arrested. Nothing really happens. So yeah, what are the protocols for that?
Thanks for the question, Matthew. We'll turn it to Inspector LaPlante.
Thank you, Matthew, for the question. Unfortunately, society has really changed over the last 20, 30 years in their stance on, drug use and open alcohol. And really, the police services are really following the direction from our federal grounds and our courts. There's a common theme now, right, that the courts are not proceeding or prosecuting simple drug charges or simple possession charges in court unless there's major public safety concerns. The Crowns are really seeking alternative measures to divert cases from the courts. So prosecutors must consider not only whether or not there's a reasonable prospect of conviction based on the evidence available, but also whether or not the prosecution serves the public interest. Now, you're dealing with people who unfortunately are addicted and have addictions to drugs, and I don't believe that the courts see that as a reasonable to prosecute people in public interest. So we are, the police service, I can say, is continuing to pursue people who are trafficking in narcotics for the purpose of trafficking. However, simple possession, unless there's some other exigent circumstances involving that, the courts have deemed it not to proceed.
Thank you, Inspector. And we are getting a lot of questions on our online forum as well. Just a reminder, if you're on the line, you have a question, press *3. Nuzumo asks from our online forum, how can people sign up for outreach services?
Yes, that's me. So like I said with the last caller, the 211 is how to contact our outreach program. And when you get the voicemail on 211, leave as much detail as you can for us, and that will go to every member of my team that's on, and somebody will be out to help you as soon as we can.
And if I can just jump in, I think it's important just to point out, like the good work that NASO does, the 211 service has been a real help to the city and to the region in allowing people and giving them a forum where they should be, contacting if they identify something in the community that they're concerned about. If they see somebody living, rough, unhoused, in what appears to be a dangerous situation, like call 211 and leave that information with NASO. That's how NASO figures out where they need to go and who they need to help. So I really, one of the biggest take-homes tonight that I want people to go home with and remember is 211 is your first line, and ask for the NASO mailbox, because they're checking that constantly. And that's, I know on my walks through 12 Mile Creek on a daily basis, I've left a lot of messages at 211 because I want to make sure NASO's aware of what's going on in the creek area.
Thank you, Matt, and thank you, Mayor Matt. We go back to our online forum for our next question from Sarah asking, are we lobbying the provincial government enough? It starts with mental health, which has been stripped.
I'm happy to talk about the political side, and then I'm going to look to some of my colleagues. I will say my conversations with the provincial government, I mean, this is topic number one, and it's been topic number one since November the 15th when I was sworn in. I've had this conversation repeatedly, and I've been very clear with ministers as well as with the Premier, and that this is a priority. This is our biggest priority, and mental health is one of our biggest pieces as well. You heard about SaveMyLife.ca, which is an incredible resource that was designed here in St. Catharines, and full credit to Steve Borisenko and his family for the work that they did, working with partners throughout the community to get that up and running. It's a great resource, but we also need more capacity in the region, and that's been a major part of my advocacy work. I'm not sure if anybody else wants to add. Dr. Kasmani?
I think we're continuously seeing that conversation with the provincial government, with the federal government as well, looking for additional funding and additional resources to support people who have mental health problems or mental health illness. And we're very thankful to our regional councillors for their ongoing advocacy. There's always room for more support for the services we provide.
Thank you, Dr. Kasmani and Mayor Mat Siscoe. And thanks to Sarah from our online forum for that question. We're going to go back to the phones now. It's *3 if you have a question, Susan is on the line. Susan has a question about the value of safe injection sites. Go ahead, Susan. Susan, are you there? All right, we're going to move ahead. I think Susan wasn't listening, so we're going to go to Jim now. Jim, what's your question?
Yes, I was involved, or I know of a case of an adult with serious mental health problems, addiction problems, who eventually ended up in Vancouver and wandered the streets for many years and so on. But they had a service out there. They had a building which was devoted to housing these people in small bedrooms, but they came and went. That is to say, they went there for the night and slept over in the night, and then they left the building during the day. I'm not sure how it worked during the day, but I do know that this individual who was housed in this building settled in, began to improve considerably. He eventually died there in his room, but his last 5 or 10 years were much more sensible than just him being out in the streets seeking shelters. Has anybody on your staff looked at the kind of solutions they've developed in Vancouver or elsewhere?
Thank you for that question, Jim. Cathy Cousins from the region.
Thank you, Jim. I think the first thing I can offer you is that we look at best practices from across the country and, quite frankly, across the world. And Vancouver is definitely a city to watch. While we don't have something that exactly replicates what you were speaking to, our bridge housing program does have a significant amount of similarities. It is, as you said, small units, bachelor units. It is basically your home for 6 to 8 months, and we wrap around you with that really intensive supports to address mental health, addictions, life skills, and help you move forward with your housing-focused goals. This program is about 6 to 8 months, and the idea is to create a significant amount of stabilization in your life, and then we can move you through to some of our other lighter touch and less expensive programs, and that way we can bring new people into the bridge housing program. So this is one of the really exciting parts for me of the 320 Geneva Street project, is this is the land that is going to provide the region with the opportunity to build our second bridge housing here in Niagara Region. So thank you.
Thank you for that, Cathy, and thanks for the question, Jim. We're going to go now to Rob, and Rob has a question about 12 Mile Creek. Go ahead, Rob.
Hi, yeah. I was talking about 12 Mile Creek, and you were saying, Niagara Regional Police was saying that they were going to provide foot patrols and that. I'm just wondering if there's any kind of a schedule that could be, so that, I know as a kid I grew up going down there, and it was great, and I'm just wondering if there's any kind of a schedule that they could create so that people like me could feel safer going down there. And I'd also like to commend the mayor and Niagara Regional Police on just having this town hall so that we can all actually air our differences and get our opinions out in the open. So thank you.
Appreciate that comment, Rob. Inspector?
Yes, thanks for the question, Rob. Unfortunately, we can't commit to scheduling just based on our calls for service throughout the city. We are down there regularly. I guess I could offer some pieces of advice for your own personal considerations, is just to stay on the well-used paths. If you're going down there at nighttime, make sure it's well lit. Stay on the trails, avoid any dense bush areas. If you're able to, walk with another person. Just be aware of your surroundings to give you that sense of safety down there. It really is a safe path. Try not to be distracted. It's tough nowadays, but if you're using a cell phone, don't get distracted by cell phones, or you're walking with earbuds in, maybe consider using only one so you can hear your surroundings around you. As well as we do work with the city in regards to crime prevention through environmental design, and that's basically, investigating or reviewing areas that may be overgrown with dense bush, and perhaps it's involving lighting or clearing paths out to provide better sight lines to improve that safety piece that you're looking for.
Thank you, Inspector LaPlante. Mayor Mat Siscoe?
I'll just jump in, and Rob, I appreciate the call. I had mentioned earlier, but like you, I'm down 12 Mile Creek every day. I walk my dog down on the Bruce Trail, between Martindale and Wellandale and up around, and I've gone through the downtown. I jog down there, and I know a lot of residents in the community reach out to me on a regular basis because they see me down there, and they're down there as well, and they see a lot of the issues. One of the things that I think is really important, I mentioned 211 a minute ago, and I'm going to mention it again. It's really important, and this is another thing, and this sort of goes for everybody in the city. If you see something that has you concerned, there's a reason for that concern. It needs to be reported. And I've heard a lot of people say, I get frustrated because I call something in and nothing happens. No, in that individual instance, that may be the case. It may be that, it's not on the priority list as high as it should be, but because of things happening. That doesn't mean don't report it. You still have to report it. Because I know from my perspective, as the mayor, when I go to advocate, I need to have statistics. I need to have data. I need to have information that I can bring, and it can't be anecdotal. It's got to be things that are community partners and the NRP and NASO. It's got to be things that they've identified as well. So if people see something, you got to report it, because ultimately you're also hopefully getting help for that person, right? If you go past an encampment on the 12 Mile Creek, under the 406 bridge, and you call that in and NASA wasn't aware of it, maybe that's the day they're able to go in and find housing for somebody that's in that spot. It has to be reported. We need to know about it. And it's, a lot of times, and I understand the frustration. I do. And, I'll go into Tim Hortons and people will talk to me and they'll express that frustration. There's constructive things we can do with the frustration, though, that might be able to move the needle and continue things going. So if you see something, please reach out to 211. If you see something that you think is an illegal activity, call the NRP and make sure that it's reported so that they know that it happened and it's not just something that gets lost. We can't just complain about it. We have to make sure we're reporting it to the right people so that we can use that when we go to the provincial government and say, hey, we need more for mental health, or we need more for addictions, or we need more for shelters. We've got to have that data as well.
Thank you, Mayor, and thank you for that question, Rob. *3 if you're on the line and you have a question. We're going to go now to Amy. Amy wanted to discuss 320 Geneva Street project. Go ahead, Amy.
Hi there. Thank you for having the town hall meeting. I wanted to say thank you for 320 Geneva. It is definitely along the lines of what I've been hopefully, had the word out for a few years now, but I'm wondering if it's possible. I know that the region is in control of it, but could we not help give the idea that if every town and city in the region gave a parcel of land, that we could start a tiny home movement, and, whether it be bridge housing or affordable housing, I think it would not only have security for the people that are homeless, but it would also give security to residents in each community, knowing that everyone is safe, they have a place to live. I feel that crime would be down. I also feel that the safety of the individuals, instead of going into a mass shelter where you can spread, illnesses or, bed bugs or anything like that, if you had a tiny home, it would be yours and yours alone. Is there something that we could do about convincing the region to do something like that?
I'm going to jump in for a second, Judy. I appreciate that. Thank you for the kudos about 320 Geneva. I will say we hear a lot about tiny homes. I'm actually not the expert on it. I've read a lot. I had the chance to go up to Kitchener-Waterloo a few months ago. They do have the tiny homes experiment there. I know that it's had mixed results, though. I'm going to turn it over to Cathy Cousins, though, because she really understands what's been going on in this area, and I think she can speak best to it.
Thank you for that, Mayor. I think there's absolutely a place for tiny homes, but I think it is more in the space of secondary dwellings and creating overall capacity in the system, because we simply just don't have enough housing, enough affordable housing, enough market housing. So there is a real opportunity to create some movement within the homelessness and housing system by adding these additional low-cost spaces. But I will agree with the mayor, it makes me a little nervous at the idea of putting extremely vulnerable people in these isolated spaces without necessarily the fulsome opportunity of the wraparound supports that an opportunity like bridge housing and a shelter environment can provide. But as people are ready to graduate or mature, having those secondary opportunities throughout the general market is an opportunity that can be explored.
Thank you for the question, Amy. Thank you, Mayor. Thank you, Cathy. And we're going to go to one of our questions that was submitted prior to us starting. And the question reads, folks experiencing homelessness will not have the same access to this forum. How will those with lived and living experiences of homelessness, addictions, and mental health issues be heard?
I'll take a swing at that, and then I might turn it over to Dr. Kasmani and Cathy Cousins again. I will say, and this is a really good question, it was actually, when we announced the telephone town hall, this was one of the criticisms that came in, and I think that's fair. I think we should recognize that many of the folks in our homeless community do have access to this, but some don't. It's been something that I've tried to do diligently, is get out into the community. I've had the chance to talk to the folks at the Westview Center for Women. I've gone down into the encampments a couple of times to have conversations and talk to people with that lived experience. The lived experience piece is actually really important. I think it informs a lot of what we are trying to do now. With respect to the question about tiny homes, the lived experience of people who've been in tiny homes, they've been the ones to say, listen, maybe it makes sense, but it can create real problems for vulnerable members of the population. So I think it's important that we have to listen to them, and I think we're going to continue to do that outreach. Before I go to Dr. Kasmani or Cathy, I am going to look to Matt from NASO because I know he has some of that experience as well.
Sure, thank you, Mayor. So one of the things that we wanted to make sure is that the people that are experiencing homelessness had an opportunity to submit questions and be heard. So all of our team members for the last 3 days have been offering the opportunity to everyone that we encountered to make sure that their voice was heard. So I just want to make sure that that's known. Thanks.
Cathy Cousins from the region.
Sure, and just to build on where Matt was going with that, we did connect with all of our homeless agencies and let them know about tonight, gave them the opportunity to work with clients and submit questions ahead of time or work with them to participate this evening. And building on the mayor's conversation around lived experience, we have an entire task force of lived experience individuals that inform our policies, our decisions, and are a sounding board for us as we work through investments and program changes. So they were all very much aware of what the opportunity was this evening, and were able to spread that through their connections as well.
And Dr. Kasmani.
Yeah, in public health, one of the main tenets we have is nothing for you without you, where we want to involve people with lived experience in all of our decision making so we're able to get their perspective. This includes our work with different partners, different partner agencies who may have frontline experience and be directly working with people who may be experiencing homelessness, addiction. In terms of our health promoters, we also have community health brokers who go out directly within the communities and work with people there. We have family members as well who sit on different committees as well. And that is a really important part of what we do, to work with people, get their perspective in order to provide effective solutions.
Thank you, Dr. Kasmani. And we're going to go back to the phones now. Again, if you're on the line, you have a question, it's *3 to get into the queue. Judy has a question surrounding mental health and addictions. Judy, go ahead with your question.
Oh, hello. I've been listening to a lot of it. I missed some of that conversation about the 320 Geneva, but from what I gathered, the last sentence I think I heard, it is sort of like a transition home, and we need more of that kind of thing where people actually can get off their addictions, that get counseling and guidance and life skills and get off, because it is a problem. There's many people on the street for different reasons, or many people who don't have a place to live for different reasons. Maybe the small homes would be for people who are not suffering from addiction or not needing mental care. You know, we have to treat all of them not as the same package, but deal with the issues that created their problem, the problem they're having with where they have to live, and that's what I'm thinking anyway. So I do like the idea of not just thinking it's just a homeless issue, because a roof over somebody's head is just part of the answer, so they won't be hurt by the elements, but it's not a solution to mental illness or to drug addiction. And I agree with the lady who phoned who does have experience as an addict, saying that the last thing you want to do is start giving them drugs and free needles. So that's what I have to say. That we have to have some kind of proactive solution for people who need help.
Judy, and I appreciate that. And I will say, I agree with you. Like, when we talk about homelessness, we can't talk about homelessness in isolation from the drug addiction piece, from the mental health piece. Not everybody who is homeless has a drug addiction problem. Not everybody who's homeless has a mental health issue. But those three issues are still intertwined. And you're 100% correct. It's not good enough to think that, oh, well, we'll get shelter for someone and then everything's better. That's not the reality either. And I think that's why, I mean, people, or at least at City Hall and people around City Hall, hear me talk about the bridge housing so much. But that's the reason why, because it's those wraparound services and the support that needs to be there to help those people that have those issues intertwined. If homelessness is the only issue, well, then the shelter is the biggest part of the solution. But as soon as it's not the only issue, then those other supports have to be there. I'm going to look to Dr. Kasmani to maybe add something to this.
Yeah, I think in terms of when we see what leads to addiction, oftentimes the social determinants of health are very strong predictors. So in fact, your early childhood experiences and having negative childhood experiences, and I mean serious negative childhood experiences like abuse and neglect, that really can contribute down the line. I actually do think housing plays a significant role, and when I speak to my colleagues physicians who provide safer supply, they tell me that they didn't appreciate until they started doing this work how much housing actually impacts things and how much not having safe, stable housing, a roof over your head, somewhere to go to the washroom safely, somewhere to keep your things, even having that can really impact. And I will say again that addiction is a physiological response. It's not something that we can just turn off and turn on. And so when we talk about things like safe supply or safer supply, when we talk about harm reduction, that does prevent a lot of harm. That does save a lot of lives. It's really important for us to know that the data is very clear that these are very effective programs. And in the long run, they actually do help reduce drug use. It's not instant, and I know it may not always feel nice, but it is very effective. And if we do want to reduce or see less addiction, these are some of the paths that we need to provide to people for them to be able to use less drugs or none at all.
Thank you, Dr. Kasmani. Thank you, Judy, for the question. We're going to go now to Bunty. Bunty has a question about how citizens can approach other levels of government. Bunty, go ahead.
Yes, hello. Mayor Siscoe, I came and visited you earlier this year and told you about Nanaimo, where my daughter is a social worker. The government in BC, I think, is a little ahead of the government in Ontario, and I'm not a political person, but Premier Eby was at that point Minister of Housing, and Sheila Malcolmson, who I believe has the St. Catharines connection, was Minister of Addiction and Mental Health. They actually gave packages of money to Nanaimo and other cities that had huge tent cities on Vancouver Island, specifically oriented toward housing, picking up property, fixing up houses, blah, 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 blah. And it's been fairly successful. I mean, it's not 100%, but it has really worked well. My question is, as a humble citizen and a frustrated old lady with governments, period, how do we put pressure and back you on asking for more money? Because we need money to do a lot of these programs, and we need to talk to our Minister of Housing, if we have one, and our Minister of Mental Health and Addiction. I don't know if we have those two animals. Please tell us what to do.
Bunty, you were one of my favorite meetings that I've had, and this is one of my favorite calls today as well. And I really appreciate you asking that question. It is so absolutely integral and important. If I could ask everybody on this call, reach out to your member of provincial parliament. Reach out to your member of parliament. And I will say, and I said it before, and I will say it again, we're very lucky in St. Catharines. We have MPPs and MPs from all three of the major parties who understand and are listening very clearly. This is no longer a matter of educating our local representatives. It's a matter of giving them the firepower to go to Queen's Park and go to Parliament Hill and impress upon the system that is the provincial and federal government that dollars actually have to flow. And from my perspective as a politician, like, I will continue to do that. Every meeting I have at Queen's Park, every meeting I have on the Hill, I will have those questions with any minister I can shake down for 5 minutes. But if residents bombard our MPPs and our MPs and their political parties with the messages like what we're hearing tonight, we need the funding to come to flow to Niagara. And I'm going to tell everybody, we got $9.6 million in the last provincial budget additional for homelessness prevention. That money didn't happen because of a politician. If I'm being completely honest, it came from residents in St. Catharines and Niagara. It came from the staff at city and regional headquarters, at City Hall and regional headquarters, making the case over and over and over and over again, and giving ammunition to the political representatives from this area to make the case to the government that we were underfunded. And we were, and we still are. And while I'm incredibly thankful to the provincial government for the additional $9.6 million this year, and I have thanked the local MPPs, both in the NDP and in the Conservative Party, for that additional funding, I've been very clear. We need more. So as residents in our communities, send those messages through to your MPs and your MPPs. They are doing good work, but they need the ammunition as well when they talk to the people on Parliament Hill, at Queen's Park, who are going to make the ultimate funding decisions. And if they have the evidence, if they have the ammunition, then they can make those cases on our behalf.
Thank you, Mayor. Thank you for the question, Bunty. We're going to go now to Myra, and Myra has a question about safe injection sites. Go ahead, Myra.
Oh, hi there. My question is, okay, do we have any statistics regarding the safe injection sites? How many people are using it? Are there a lot of repeats? I know we've saved quite a few people. And what is the what happens to these people after? Do they go to? Are they referred for rehab? That kind of thing. That's what I'd like to know about that. And also, the other question I have is about mental health. Is there an outpatient facility that has daycare for mental health patients, where they come in, they can have group therapy, they can have individual therapy, they can have all sorts of things happening there?
Okay, thank you for the question, Myra.
I'm going to look to Dr. Kasmani on that one.
Yeah, so that's a good question. I think our colleagues at Positive Living Niagara, they administer the supervised consumption site, and they note that there's about 450 people who use that space. Some use it daily, some use it once every few months. And overall, when we look at supervised consumption sites or safe injection sites, we do see a number of benefits. Across Canada, there's been some good studies and across the world that show that they reduce the spread of bloodborne infections, they reduce violence, they reduce overdoses, they reduce fatalities, they increase access to health care, and they reduce arrests overall, especially while people are intoxicated. For the second part of your question, I think it was to do with daily services and ongoing services. And I think that's where we see the biggest need in the area. So that ongoing connected care is probably the area that has been identified that has the biggest gap. And so when you're going and you're speaking to your MPPs and your MPs and you're advocating and helping us, that's the area where we can use the most support, is that ongoing wraparound follow-up care rather than just focusing on that crisis care.
Thank you, Dr. Kasmani. Thank you, Myra, for the question. Michelle, you're up next, and Michelle is on the line with a question about receiving additional funds from other levels of government. Go ahead, Michelle.
Hello, everyone. Thank you so much for taking my call. I understand that this is a multifaceted problem with the encampments, with drug addictions, with mental health specifically. I am going to give you some personal information. I am a mother of a 30-year-old daughter who has been an addict for 17 years, and she has been homeless for at least 2.5 years now. And when I say homeless, I mean homeless as in sleeping in under cars, in bus shelters, anywhere she can find in the middle of winter, sleeping in tents, sleeping under bushes, you name it. She's been raped, she's been stabbed, she's had everything that a poor young female could have done to her in that situation. And quite frankly, because of the lack of ability to access mental health care, which is something that she has identified to me that she needs, one of the things that frustrates me the most is that I've been, in the last year or so, preparing myself for a detective to basically knock on my door or give me a phone call to ask me to come identify my daughter's body or to inform me that my daughter has passed away. Most recently, about 2.5 weeks ago, my daughter was assaulted to the point where she almost passed away from her partner. It was a partner of convenience. And I want to speak directly to the physician and the police at this moment. Back in the 80s, I'm of that generation where we had donations on TV, people asking for donations to the point where we had donation fatigue. Everybody was so overwhelmed with hearing about it, they just basically tuned it out. We're now in a situation where we've heard about addictions and homelessness and the cost of living to the point where we are at a place of being fatigued. For you guys, I hear the compassion in both of your voices about how you deal with. I can really tell that when you're dealing with somebody who has an addiction, that you are compassionate to them, that you understand that there are some underlying causes, such as with my daughter. There's the mental health aspect with my daughter with her addiction. I want to thank you for that compassion. I will let you know that it is not widespread within your communities, though. Quite often in the health community, most recently, like I said, with the assault that she received, she was very much dismissed at the hospital during her treatment. Unfortunately, it was an unfortunate experience for her. And it was simply because they did know that she was an addict and was basically a frequent flyer with overdoses. I'm not sure if that's true of every addict. I'm not sure if it's because of her personality and the way that she interacts with staff. Could be isolated. I'm not sure. My question for everybody here is that one of the key components that I see for housing in particular, as far as homelessness is concerned, is the mental health piece. There are simply not enough programs out there to access, and there's simply not enough funding, like what we've mentioned, and we do need to put a lot of pressure on our MPs and our MPPs to request that funding to initiate programs like wraparound programs, like Second Start programs, like programs that will continue to see people through. Because if I don't have $20,000, which I don't, I am disabled, and I too have experienced homelessness and lived in a shelter because of my disability and the inability to walk up 13 steps because I was in a wheelchair. I was homeless and in a shelter until I got a call and ended up in housing. Unfortunately, what we're going to see are more people and more people falling into that state of homelessness again if we don't address the MPs and the MPPs to get funding into our areas, all of Ontario. We are not the exception to the rule. We are the rule. This is North America wide. It is completely North America wide.
Thank you for the question, Michelle.
Michelle, I'm going to start, and I'm just going to say thank you. I don't know if I was expecting someone to really explain one of the myriad of situations that could result in people winding up homeless, and I think for everybody who was on the call, I think everybody appreciates that because that's the lived experience. That's the piece that a lot of people just don't understand. So I want to thank you for that. I can only say for myself, but I know this is shared by everybody at the table, we're all going to remain and stay committed to advocating for that additional mental health care. If there's one thing that our community, and I think everybody has learned over the last 10 years, it's the importance of mental health and how we haven't treated it the way we treat other forms of health in the past, and that we need to make greater investments in it in the future. I don't know if anybody at the table wants to add. Dr. Kasmani might be the best place.
I think I would just add, I'm sorry to hear about everything your daughter's gone through, especially how she may have been treated while in healthcare. I think healthcare can sometimes be no different than other areas where there is a lot of stigma, and there's a lot of work that we have to do in our field to make sure that people appreciate the experience, the lived experience people who suffer from addictions may have. And so I'm just very sorry to hear about that. And I think in that advocacy, again, it's really those ongoing services, those community-based services that can help prevent things from getting worse that we would be finding the biggest need.
And Cathy Cousins wanted to add something.
I'm just going to add one little piece very specific to your situation. I wouldn't want to see your daughter not get the health support she needs. So please reach out to one of our shelters. Reach Niagara, which has medical physicians, do have clinics within the shelters several times a week in various shelters. So please reach out if she's not comfortable getting her medical support elsewhere to ensure she gets that follow-up. Thank you.
Thank you for that. Thanks for the question, Michelle. We're going to go now to Stephanie on the line, who has a question about rent control. Go ahead, Stephanie. Stephanie, do you have your question ready?
Yes. All right. Can you hear me?
Yep, go ahead.
Can you hear me? Okay,
yeah,
sorry. Yes, so my question is kind of
Stephanie's cutting out a little bit there. Is there a better spot you can go to so we have a better connection?
Yes, sorry, I'm just walking away from a tall building. Can you hear me better now?
Go ahead, Stephanie. Thank you.
So my question is there any plans for rent control for those individuals who, like myself, are working 2 jobs to just barely get by? It's difficult for a lot of people, and a lot of people in my line of work, which is in healthcare and supporting individuals with disabilities. They just can't afford to live in a 1-bedroom apartment that is costing $1,600 a month when I only make $2,000 a month, let's say, and it's getting so ridiculous and frustrating. Like, people are in debt, people are becoming homeless because they just can't keep up with it, and working multiple jobs, like, it's just crazy.
Thank you for the question.
Thanks, Stephanie. The challenge we have as a municipality is we can't enforce rent control. However, Ontario does have a rent control guideline. 2023, the increase is set at 2.5%. However, that only applies to buildings that have been built prior to 2018. So if you're in a building that has been built after 2018, that 2.5% rent increase unfortunately doesn't apply. But Ontario does have some level of rent control. So if you have concerns that that's not being adhered to, you can simply go on a Google search for the Ontario rent control guidelines, and it will give you information on how to deal with your landlord or the situation that you may have.
The one thing I will add, and this comes up a lot of times because St. Catharines has an extraordinarily low vacancy rate, and that's part of the reason why our rents are as high as they are. They are abnormally high for a city of our size, but it's because our vacancy rate is essentially 0. Like, there's nowhere for people to go. And so, when there were lots of rental apartments in the community, then, if someone was trying to up your rent too much, you could go somewhere else, and there was a lower cost option. But the simple reality is that's not the case anymore. So one of the things that our council has said is, like, we want to try and prioritize purpose-built rentals in the city. And, there was an open house, it's going back about a month and a half ago now, for the old Queenston site, and plans that had come forward and were being presented to the community, about 1,100 purpose-built rental units in that location. And I went to the public open house and listened to the questions. One of the questions was, well, why aren't they affordable? Well, this goes back to that idea about developers needing to have a return on investment. But here's the reality. If 1,100 new purpose-built rental units went up on that site tomorrow, the rent in St. Catharines would come down, because the market would be flooded and there would be options for people again. And then the landlord who's trying to say, well, I'm going to charge you $1,800 for a bachelor basement apartment, wouldn't be able to do that, because you could say, no, I'm going to go over there where the rents are more reasonable. And that's why we need more supply in the system as well. As Mr. Oakes said, rent control is a provincial issue. I would advocate, if you believe that rent control is the right policy, then talk to your MPP, because that's where that change would have to come from. From the city side of things, we are doing what we can to encourage developers to build purpose-built rentals, because we know additional supply will help bring the prices down. That's one of the reasons why we were encouraging and will continue to encourage accessory dwelling units, additional rentals that can help.
Thank you for that question, Stephanie. We're going to go now to Rochelle, and Rochelle has a question about a rumor she heard about some buses. Go ahead with your question, Rochelle.
Hi. So I have heard rumors of other regions or other cities that send buses or cabs or whatnot, some sort of transportation with homeless people from other regions and other cities, because of the way that St. Catharines is labeled as like a comfort city or a care city. Now, I'm not sure if that is true. Maybe you can tell me. But regardless of whether or not it is there something that the Niagara region is doing to reach out to other regions or other cities to support them with their homeless community as well? Are other regions working together with the Niagara region so that they can share ideas or advices with each other to tackle this problem on a broader scale than just here?
Cathy Cousins, go ahead and answer that question.
Thank you for the question. I will start first with your conversation around the rumors, and we go through that experience pretty much annually. But the good news is our data management system for homelessness, one of the questions we ask all clients is, what do you consider to be your home community? To get a sense of how many individuals resonate from one of the municipalities of Niagara versus somewhere from out of town. We do track that on a regular basis. I can tell you that we took a look at this, anticipating the question tonight, and we were around 11% last year, and we're tracking around 12% this year, so we're not seeing a significant change. We also, just to double check, in case, I don't always trust data, is we have a second opportunity when we do our point-in-time counts, which is approximately every 2 years. And again, part of that survey is about your community of origin. These stats that we're getting out of our system align completely with our point-in-time counts in the past, so I'm pretty comfortable with the numbers, but yes, I can assure you we're always watching it and tracking it and asking that question. The second part of your question was about how and do we work collaboratively with the other regions nearby us. Community Services at Niagara Region is part of a broader group that is representative of all 47, what we refer to as service managers, but basically regions like ourselves who have an accountability for this portfolio. And we get together regularly, and we have conversations, and we actually have a task force that meets monthly where we all share each other's best practices, ideas, things worked, things that didn't, and have a pretty good sense of how other communities are doing on the same front. So absolutely, we will borrow great ideas from anywhere.
I'm just going to jump in very quickly, only because I have this conversation with other mayors as a member of the Ontario Big City Mayors group. And the truth is, every mayor is hearing the same thing in their community. Here we hear that, folks are coming down from Hamilton and Burlington and Toronto. And if you go to Burlington, they're hearing that it's coming from Hamilton and London and Kitchener, and if you go to Kitchener, it's people coming from St. Catharines and Hamilton and London. We're all hearing the same thing, and it's another one of those things. It gets passed around, and a lot of people talk about it. But when you actually talk to the folks who are in our system, they'll tell you, no, I'm from Fort Erie, or no, I grew up in St. Catharines, or I grew up in Thorold. The folks that are in our community, and so I'm glad we had a chance to address that tonight as well.
All right, thank you, Cathy Cousins. Thank you, Mayor, and thank you for that question, Rochelle. And we're almost at the end of tonight's telephone town hall. And before I ask our speakers for some closing remarks, I want to remind you all that everyone on the call at the end will be able to leave a voicemail message with any questions or comments about the homelessness, addiction, and mental health crises. Mayor Mat Siscoe, I'll hand it over to you now.
Thank you, Steph. I want to thank everybody for the feedback tonight. I want to thank everybody for the questions. I want to thank, I think it was Michelle who gave a very in-depth explanation of one family's experience with homelessness, and I think that was really important. To the 3,630 people that stayed on for a very significant portion of tonight to listen to this conversation and ask a question, thank you. This is a difficult issue to deal with. It's difficult for the people who are living it. It's difficult for the people who are living around it. It's difficult for the community to try and find solutions that make sense. And whether you're involved delivering services or you're a person experiencing homelessness, you're a business owner, you're a resident, this is tough. And it's something that's going to take time to deal with. But I appreciate everybody who took the time tonight to try and become better informed about what exactly is happening in St. Catharines and Niagara. I really want to thank CAO Dave Oakes, Inspector Rob LaPlante from the Niagara Regional Police Services, Cathy Cousins, who's our Director of Homelessness Services from Niagara Region, Dr. Kasmani, who's the Medical Officer of Health and Commissioner of Public Health and Emergency Services from Niagara Region, and Matt Derricks from Niagara Assertive Street Outreach. The participation tonight has been fantastic, and I really appreciate all of you giving your time to be able to better inform and answer questions here in the community. Before I wrap up, I just want to remind everybody, if you have additional questions, please feel free to leave a message for us if you're on the line this evening. You can email us at tth@stcatharines.ca. TTH stands for Telephone Town Hall, so tth@stcatharines.ca. Or you can visit stcatharines.ca/homelessness for more information on what the city's doing and to address social issues in our community. So I appreciate everybody. Thank you for your input and your questions, and I hope you have a wonderful rest of your evening. Thank you.